So doctor, if you are a diabetic, obviously, what are some of the things you can do to avoid problems with your feet? Obviously, we're talking about prevention. Education is a big part of that. But what are some of the things someone who is either a diabetic or pre-diabetic or just taking care of your feet in general? I mean, what are some of the things, especially with a diabetic, what they can do to avoid problems with their feet?
Well, there's a number of things. The most important, I would suggest to every diabetic that's listening today and watching the program today, is to go see their specialist. Go to the podiatrist or have your primary care physician refer them to a podiatrist for, again, a podiatric physical. That's number one. Number two, things that you can do at home is you check your feet every day. You don't walk barefooted at home. You're always wearing some kind of protective shoe gear.
Why not walk barefooted? I mean, a lot of us like walking barefooted. Why not?
Well, you know, for patients that have diminished sensation, they may step on a piece of glass, a small nail, and may not even feel it. And so what happens is that puncture basically in the foot can introduce bacteria and can introduce an infection.
Talk about preventing of any cuts or any bruising and things like that.
Correct, and that's why checking your feet every day, you check for swelling, you check for redness. Many times patients come in, and the biggest issue is that when they come in, they say, you know, doctor, I'm having a little bit of discomfort. I feel like I have the flu, but my foot doesn't smell very good. And then when that happens, you know, you're probably admitting the patient to the hospital for IV antibiotics and possible surgical intervention, which is, you know, incision and drainage and debridement of infection.
So if there's a foul smell coming from their foot, obviously, would it be obvious then that there is a bruising and or cut or opening or sore? What
happens is if there's a foul smell, it's an emergent situation. That means you have to go to the emergency room. You know, you cannot stop to clean the house. You know, I've had patients with, you know, that they come in with a bad infection and they say, well, let me go home and I've got to work some things out and clean the home and things of that sort. When they don't understand, and that again is the responsibility of the doctor to say to them, listen, this could be life-threatening. We don't know what kind of infection or what kind of organism is in that infection or causing the infection. You need to go directly to the emergency room for, for evaluation, X-rays, IV antibiotics, and possible surgical intervention. So when we talk about checking your feet every day, you know, you check your foot. You can check the bottom of your feet with a mirror. People say, well, my feet feel better when I soak my feet. Well, I don't recommend soaking your feet in any water unless you can have someone check the temperature of your water if you're neuropathic or if you have diminished sensation, because sometimes what will happen is I've actually had a patient who burned both of her feet.
Because no feeling at the feet.
No feeling.
Plus hot water.
And that's correct. And basically when the patient presented to the office, she almost lost both of her feet. And so I don't recommend soaking the feet. You know, also when you need to dry, after you take a shower, you need to dry well between your toes so there's no maceration between the toes, so there's no fissuring of the skin. Again, a portal of entry for infection. Your skin, the skin on your body is your suit of armor. It's what protects you. So if you take good care of your suit of armor, then you're going to keep infections from becoming a problem. Not cutting your nails. You know, I do foot surgery. I'm board certified in foot surgery, and I cut patients' nails and I do debridement of calluses, which is the cutting of the calluses, because again, that is preventative care. That keeps the patients from requiring more extensive care.
Now, we know that patients too also try to do that at home by cutting calluses and not using proper instruments. First of all, they shouldn't do it, most importantly.
Again, I had a patient today that was on Plavix, which is a blood thinner, and he said, well, you know, I'd cut my nails and I'd cut myself a little bit. I would bleed for a while, but it would stop, which is, again, where you say, gee, you know, you can't do that. So no self-treatment. You shouldn't be cutting your nails. You shouldn't be cutting your calluses. You should not buy over-the-counter medications that say salicylic acid. What I find very ironic is that those very products that are made for these calluses, in small print, it will tell you diabetics should not use it.
But most people don't read the bottle.
Most people don't read the bottle. Not only that, but most diabetics have problems seeing.
Right.
So these are the same patients
Right.
that go ahead and put callus remover, ingrown toenail removal, and all of those products are all, they contain salicylic acid, which is a burning medication. I've had patients that have tried to remove warts with these over-the-counter salicylic acid, and with patients, again, if they have bad blood flow and they burn themselves, it's going to be very difficult for them to heal these areas and develop ulcers as well. As far as, so we all understand that you shouldn't treat yourself. That's number one. Number two, what else can you do? The podiatrist can make protective, have protective gear made for you. And what I mean, shoe gear, for example. I participate in a diabetic shoe program. Medicare covers diabetic shoes. Well, why a diabetic shoe? What are the
What's the difference between a diabetic shoe? You're bringing up the question. And that actually was my next question, because I know that when we're looking for even socks, even shoes, the idea of how to buy those shoes if you're a diabetic, and when should you buy the shoes. I know there's a saying that you should go buy them at the end of the day because your feet are a little swollen from walking around.
Yes.
And obviously you can probably find the most comfortable shoes at the end of the day if you're shopping that late.
Well, let's talk about.
So let's talk a little bit about that, because I know there's inseams of socks and
Yes.
no seam
Yes.
socks, and
Yes.
and how does that affect the diabetic?
Well, again, any areas. Let's talk about the socks. Any socks that are tight, like around the knee, is going to inhibit your blood flow. Okay, and then by the end of the day, it works almost like a tourniquet, which cuts off blood flow if that sock is just, it's not a custom made sock, because there are custom made socks that are compression support hose, but those socks or stockings are prescribed by the physician because he's evaluated the patient's blood flow.